Doylestown Health had a tremendous response to this pandemic. Everybody came together in ways that were unprecedented. It was at all levels. It was from the CEO of the hospital, all the administration, nursing, and I think that boosted morale.
I've been a physician now for well over 30 years, and I've been in my role as chief medical officer for about 15 years. And I would say in all the various clinical issues I've been involved with, I don't think there's anything I've been more proud of than the way we've been able to manage this pandemic at Doylestown.
We could see this was just a matter of not if, but when. So our decision was to just keep everybody in play, everybody's working. And so we had a lot of work to do to make sure that we had the best protocols in place, had adequate personal protective equipment, had policies in place for safe handling of things and segmenting of patients. And together we grew the trust of the organization and all the associates to feel very comfortable that this was the right place to be.
On March 31st, that was when I realized that I was getting sick. I took my temperature. I had a fever at that point. And I remember checking in, and they were pretty concerned because my blood oxygen level was low. And I had the beginnings of pneumonia in my chest that appeared on the chest x-ray. And I do remember the doctor saying, "You're not going home." It was just a very strange time, but I felt confident that I was in the right place and that I'd be taken care of.
I think Doylestown Hospital has developed an amazing maturity quickly with how to manage this illness as the pandemic became more and more prevalent in the region. The courage required to come in and face the unknown sometimes, like is someone going to walk into the office and we don't know they have COVID-19? Well, we're going to have to take care of them. We just have to practice all these measures we have and not be afraid, just be informed.
We had to improvise. We were changing our practices daily and sometimes even throughout the day. What we did yesterday wasn't part of care the following day. What we did in the beginning of the shift was out of fashion by the end of the shift. Patients were declining so quickly and so rapidly, literally within minutes before our eyes.
The emergency department had all new processes to try to separate patients coming to the emergency room with routine medical issues from patients coming in with possible COVID. In an overall sense, we had the ability to do things that I think larger health systems struggled with.
The thing that we really focused on was making sure that we had the proper personal protective equipment and that we knew what needed to be done. There was a lot of confusion initially versus, airborne versus droplet precautions and what needed to be done in reference to how we dressed and also how we cleaned the areas. And that was a bit scary for people who were expected to be at the bedside.
Without Doylestown Health, Pine Run would have struggled. Being part of the health system, we had access to staff. We had nurses come over. We had physicians come over. So the support was really there. That's the beauty of a health system. Had we been a standalone community, like many others, we would have struggled.
One of the things that is critical when you think about patient care is protecting the healthcare provider from the patient that they're caring for and from that pathogen. And at the center of care for them is respiratory protection, because it really is the barrier between the patient and the healthcare providers on mortality. And I had read about reprocessing N95 respirators and decontaminating them for biologic pathogens. There was a few different methods out there, everything from UV light to vaporized hydrogen peroxide. And I negotiated buying a Bioquell machine. So we extended our services with N95 respirator decontamination to anybody in our community who needed it.
The need for a drive-through testing area surfaced pretty early in the COVID crisis. The emergency department had staff dressed in full personal protective equipment going to patients' cars, evaluating patients to see if they needed to be seen in the ED, which a lot of them didn't. They just wanted to be tested because they had an exposure. And anybody coming for testing because they have to isolate wants to be able to have their results back in a timely manner. And Doylestown, it was unique because we managed to do that. We managed to work with a laboratory that could provide us with reagent and get test results back basically in a 24-hour period.
We had great collaboration between the intensive care unit physicians, also known as the intensivists, and the hospitalists, who were the internal medicine physicians who take care of the patients in the hospital.
Telemedicine is a patient visit via telephone or video. We've taken a quick implementation, we've learned from it, and now we can provide patients much better access both in person and through telemedicine.
We were the first in the area to have a MASH tent. That was right in the front of the hospital, and I think that made the community realize we were well prepared for what we had to deal with. It also gave our physicians who were out in the community a place to see patients, and it made them feel that we were well prepared, and it also gave the associates in the hospital a sense of security, knowing that we were trying to avoid having COVID patients contaminating the rest of the hospital.
This was a novel virus. No one knew what to do with it. And all we had was a several-month head start in other parts of the country. And through our research department, we found out a lot of different things. For instance, when I talked to the intensivists and they said their autopsies were showing tons of clotting and stuff, so that told us we better start to anticoagulate our patients early on. We also started steroids way earlier before steroids became popular. We were using other therapeutics, remdesivir. At the time that the allocations for remdesivir were going out, we were deemed a real hot spot, so we got lots of remdesivir.
Through what I believe is the love of the nursing staff, Howard Brown pulled through. He got extubated. I was there when he came off the ventilator, and we were so happy. He was the second patient actually that was successfully weaned and taken off the ventilator.
And I remember being wheeled down the hallway, and the corridor was lined with doctors, nurses, technicians, administrative staff, and they were playing Here Comes the Sun. There were tears in people's eyes. It was really a magical moment. And I just feel like I do have an appreciation just for life.
COVID-19 has affected everyone's lives in a dramatic way that probably none of us could have foreseen. It's made us all much more aware of, number one, some vulnerabilities that we all have, both individually and as societies. And it required a focus on a lot of different behaviors and focus on treatments to try to help us contain this that, again, weren't foreseen.
When a community or a group faces some adversity, it can either break you apart or pull you together stronger. In our situation, I think it just made us all appreciate each other a little bit more, and it, brings you together and brings out the best in people.
Our success in ramping back up in a safe manner was really based in science and communication with the entire staff. As you can imagine, us having to shut down essentially in many arenas of the hospital system impacted many of us, and we wanted to make sure that when we were ramping back up, not only did providers feel safe, but also patients.
Doylestown Health was really well positioned to respond to this crisis exceptionally through these continued challenges. In fact, despite these challenges, it is only reinforced that the vision that we have for Doylestown Health, the direction that we were headed before the pandemic hit, is exactly the direction we need to continue and reinforce as we continue to grow and expand for this community.